You working tomorrow? No.
Alrighty. So thank you for coming in. Really appreciate your time and to come in running the course. I'm Vanessa Sutherland. I've been a physiotherapist for 12 years now and I work up at Castle Hill. So I run things like this quite often for athletes. And yeah, glad you're all able to do the course and hope you get a lot out of it. Just want to run through a few things before we get started, just some housekeeping notes. Basically, you're all dressed comfortably, which is perfect. Are there any injuries or anything I should know about at all that anyone's got, or any reasons why you wouldn't be able to do some of the exercises or need a bit of help with? No, you're all fine? All fine with it? Yeah, no, not a worry. So let me know as we're going anyway if we have any problems and we can work with those. So we're looking at about a 40-minute session. Toilets are just in the hall here. And we've just got some water and drinks on the table there for anyone that wants any. We're not having a break, we're just going to run straight through with everything. But just, yeah, help yourself to water at any time if you need it. Just some housekeeping as far as code of conduct things, just obviously just be mindful of everyone else and just be aware of other people's needs too. Just the normal respect and listening would be appreciative. I'm happy for a show of hands or whenever you want to call something out, I'm fine. It's interactive, I want you to be involved as well, not just sit there quietly. And if anyone's got phones, can they please turn them off? That would be fantastic, please. So, alright, so what I'm going to do, I've got some handout notes. I've got an attendance form that I'll pass around at the end as well. And just get you all to make sure you've signed in because you will receive certificates at the end, certificate of attendance. We've got some pens for you as well. You don't have to run through these notes as we go, they're just in case you'd like to take some notes, they're there, and that way you obviously have some notes to take home with you after the end of the day. So obviously, self-myofascial release techniques, in a very, very basic nutshell, it's self-massage. Has anyone at all liked massages? Anyone here like massages? Mm-hmm. Yeah. Anyone find that they don't have the time or the money to get the massages as often as they'd like to? Mm-hmm. Yeah, pretty standard. So what we find it obviously a lot with athletes, they need it, but they don't have the time, they don't have the money or just the availability to get around and do it. So what we're going to do today is learn some techniques for you to do it yourself. So that way you can do it, it's portable, it's easy to do, and you can always do it from home. So just obviously a learning outcome, it's just a basic thing just so you guys know exactly what to expect. So by the end of the training session, you'll be able to define self-myofascial release, describe the benefits in releasing at least 3 trigger points, and you'll either do that by self-massage or foam rollers, and you'll be able to do that at home or in a personal setting of some sort. So why do training in self-myofascial release? So as I was saying, athletes require their bodies to perform at an optimal level all the time, but we don't necessarily always have the time to get out there, look after ourselves and treat as we should. So a lot of it is making sure we reduce fatigue, stress, tightness, all of those things that build up with our training. And when those things do build up, you get a loss of performance and you can get injury. So we want to keep on top of them all the time before they get worse. Has anyone here completed a self-myofascial course before or considered one? Okay. Does anyone not understand the benefits of massage, or anyone here not actually enjoy massage? Everyone's fine with that? Mm-hmm. Okay, so just an overview of what we will cover today. We're just going to do an introduction to the techniques. We're going to understand what trigger points are, and then we're going to apply some of those tools with self-massage and with foam rollers. So there's a lot of other techniques, but they're the 2 that we're going to concentrate on today. There's going to be an assessment as well. That's just going to be basically me doing some verbal questioning through the training program today, just some observational tasks as well. There will be a bit of an assessment in 1 week time as well. That will be done with your coaches back at your training centres, and I'll send out an email too with just some questions to answer. All quite informal, but it's just an idea of getting some feedback of where you guys are and making sure you're following everything. So we're going to start with a brainstorming activity. Can anyone think of any reasons why you would have massage, any benefits from having self-massage?
Just to loosen up your body. And
Loosen up, yep. Flexibility, yep.
ease pain.
Ease pain, perfect. Stress, excellent, yep. All great, all really great ideas. There's my little frog having a relax. So exactly what you're all saying, basically, to relax, to ease tension, re-energise, stimulate blood flow, relieve pain, it's for injury healing, and to reduce trigger point formation as well. So you've got a huge amount of reasons why you would have it. It could be for all of those, it could just be for one. So a lot of the times it helps with injuries too, because it brings oxygen to the area. So when you do have injuries, massage helps as well, because of the fresh oxygen it brings to the area, and you can get your healing a lot quicker. So the health benefits of self-massage. So obviously you've got general benefits, and then you've got specific health benefits. So we get improved blood circulation, we have muscle relaxation and reduced muscle tension, improved range of motion, increased endorphin levels, so your happiness hormone levels basically. They're a remedy for fatigue and insomnia. It can help reduce joint pain, and it can improve skin problems as well. So a lot of great additional reasons on top of your athletic bonuses. So what's a trigger point? We touched on it before. A trigger point is basically an area of muscle that's painful to palpation. It's characterised by presence of taut bands. So basically that's when you get a thickening in the tissue, it becomes tough, it becomes knotted. Most people you speak to have an idea of what a trigger point is. Most people will feel around and they can always find one. And if you see a physio or massage therapist, that's generally what they get into as well. But that's what a trigger point is basically characterised by. They form in muscles, they form in muscle tendon junctions, they form in bursa, and they form in fat pads. When they're in those areas, they can be accompanied by inflammation as well. And if they remain long enough, what was once healthy tissue is replaced by scar tissue. That's inelastic, and then you can lead to injury. So when you exercise, you need nice supple muscles, nice healthy muscles. If it's full of inelastic scar tissue, it doesn't stretch so far, and you're more prone to injury. So possible causes of trigger points. Can anyone suggest any possible causes of trigger points in the body?
Previous injuries.
Previous injury, perfect. A great one.
Posture.
Posture, definitely. Yeah, they're the only two. Yeah.
Repetitive movement.
Repetitive movement, yes, definitely. So there's some of your ones you've all been reading well. So acute physical trauma, poor posture or movement mechanics, which is right on there. Overtraining, so repetitive, is very similar to that. Inadequate rest, so when you're in a hard training week, if you don't provide those rest weeks after that, that's when these trigger points develop as well. And nutritional factors as well. People that don't hydrate, people that eat poorly, it can actually change the composition of the muscle and increase the chance of trigger points in the body. So it's really quite important to have that looked at as well, which is something not a lot of people consider. Nutrition, people obviously think is important for health, but not necessarily for muscle health. So there's a very specific relationship between trigger points and efficiency of movement. Trigger points compromise scar tissue. Let me just run through here for you. and they can lead to a variety of sports injuries, I should say. So cramps and even serious muscle tendon and tears. The theory is that trigger points compromise the tissue where they're located, and that puts a bigger strain on the neck section. When you put a strain on it, it compensates for that weakness. And so you end up with a spiral of compensation, and everything basically degenerates and gets tighter and tighter to a point where it just can't go any further. So trigger points affect the athlete in the long term. So if they hang around long enough, you actually can create a quite vicious cycle of injury. And it's a very big cause of some big names that you see out there that are doing really well, and then suddenly they drop off the radar and you have no idea where they went. Sometimes it's just a single injury that does it, but many times it's a build-up of injury that they didn't address. So this is because you have joint restriction caused by trigger points. If the joint is restricted, you actually get a change in the feedback from the joint to the central nervous system, which is basically your brain signals. You get a less efficient pathway to your brain because of it, and then that leads to premature fatigue, chronic pain, injury, and then you have less efficient performance. If you have less efficient performance, then the cycle goes around again. You end up with joint restriction and it all continues. So self-massage is a relatively simple technique that way, that you can use to reduce the muscle tension and fatigue, alleviate these trigger points, and really stop that cycle. So tools for applications of self-massage technique. You've got self-massage is a big one. Foam rollers are another one. Tennis and golf balls that you can use to roll out things. There's some really great massage balls that have come out now. You might have seen the spiky balls. Same concept of the tennis and the golf ball. It's just to release those trigger points. And you can also use frozen drink bottle on certain areas of the body too. It's a perfect example in that one of just rolling it under the foot. They work really well because they combine trigger point massage with ice application as well, so they're really good for injuries. So there's a few different types of self-massage. So self-massage is basically what you would expect from that name. Rubbing. So rubbing stimulates circulation and releases muscle tension. Lost my train of thought, sorry. Vibrating is your knocking and light slapping, I guess you would call it. Kneading, you would usually use moisturiser or oil, and it's more what you would see in massage or physio techniques. And you knead your muscles as if you're kneading bread dough. And then the final one is stroking. So final stroking is something that you do just at the end, usually over the edge, and just gentle gliding strokes moving outward. So what we're going to do, we're going to do some of this self-massage. So we're going to start with something that we can all copy. I'm going to demonstrate, and I'd like you to all just follow what I'm doing, and then we're going to do a few more on your own from there. Okay? So if you can all just pop your paper down for me. What I will do is I've got some moisturiser and some oil here, so anyone that wants to use that can. And you'll find towels under each of your chairs as well. There's a little hand towel just to wipe it off, and then there's a big towel for later if we're going to lay down on the ground to do things. Basically, we're just going to try on the forearm to start with and see how we go with that. If ever I can just pick an arm, doesn't matter which arm. What we're going to do is, the idea is to get into the habit of using it. If you perform it slowly, you actually relax the muscles of the body. So if you just do any sort of those movements we were talking about before, so we can do some kneading. So you notice if you move really slowly, what you actually end up with is something quite relaxing, and it will get into the muscle. It will, it will improve circulation and reduce your swelling. If you do something a bit more like the slapping, like the vibrating muscles. It lessens fatigue and it revitalises the body. So you've got the different techniques for the different reasons. So you can just have a bit of a play at the moment, just getting an idea. You don't need to undress. You just need to dress comfortably when you do these. Massage oil and moisturiser is definitely recommended. You don't want to sit there for too long massaging and end up with, not burns, but you get that skin friction. You're best to sit in the chair, on the floor, lie down on the floor, wherever you're in a comfortable position before you start any self-massage, and alternate your movements. So you want to do the rubbing, the kneading, the vibrating, and you can hold pressure points. When you find something that's a bit sore, hold it. Usually count for 10, 20 seconds, and then release, and then move on to another one. So it's a really good way to do it. And when you do find a knot, just work in small circles over the area. Would you like some moisturiser?
I've got some.
You alright? Good enough there? Found a trigger point? Excellent. Now, is everyone managing well with that? No problems at all? So when you do these, as I was saying before, if you perform it slowly, it will relax, and if you perform it quickly, it will revitalise. When you do self-massage at home, aim for one body part at a time. Don't sort of sit down and expect to cover the whole body. Decide to focus on a particular area or a whole arm or a specific site where you're feeling tightness, and try and aim for about 20 minutes. And you'll get a quite a good result from 20 minutes of self-massage that way. Just don't ever rush yourself when you're doing it, that's all. So some of your regions for self-massage, you've got your neck and scalp, you've got shoulders and arms, thoracic region, so thoracic is your upper spine, low back and gluteals, gluteals being your bottom, quadriceps, hamstrings and ITB. Does everyone know what an ITB is or where it is? So an ITB is an iliotibial band. It's a really common tight area in sports people, and it runs from the side of the hip down to the side of the knee. It becomes very tight because it's not specifically muscle, it's a band instead, so its properties are a bit different. So you'll always find, especially we'll go later and do some foam roller work, you'll notice it's a very, very tight, painful area. So you have those, you have the calves, and you have the feet as well. So really, world is your oyster as far as massage. You can massage anything you like. They're just generally the most common regions, I guess, that we look at. So what we're going to do, I want you to just either find a spot on the floor or in your chair, wherever you're comfortable. I want you to just spend 2 or 3 minutes, pick an area of the body, anyone that you like, and I want you to just perform some self-massage on yourself. So try and use the techniques that we went over, and just try and spend about 2 or 3 minutes just working through an area, finding some trigger points, seeing how you go with it. And I'm just going to come around and have a look how you're going and help you out with anything. Alrighty? Is there a preference between oil or moisturiser with everybody? Fine?
Yep.
Fine either way?
Yeah.
What I'll do is I'll just hand some out for you. So just pick an area, whichever suits. And obviously there's a lot more here to use. Yeah, you can sit on the floor, absolutely. I always find it more comfortable on the floor than in a chair. It just depends what you're massaging. And perfect, perfect. It's a great one to do. So we've got some good choices here. We've got feet, head and leg. Excellent. You can choose the same, you don't have to do anything different. I just want you to try it. It's exactly perfect rubbing. Perfect, that's really good. When you do that too, see how your fingers are quite high coming up. If you find you flatten your fingers, you might get a bit more pressure. And same thing as you're going through there, if you change it to knuckles and try kneading once it's warmed up, you'll probably get an even deeper pressure again. Perfect. Is there a specific reason why you chose head?
I want to promote hair growth.
You think we can do that? We'll give it a go. We'll absolutely give it a go. I don't know if it will help your sport, but we'll see. Head though, it's funny that he should say that though, because a head isn't a typical area where you would consider massaging in sport at all. It's not somewhere where you necessarily get injured or need a lot of muscle release, but you carry so much stress. And especially if you're coming into a big performance or a big event, your head's the one that's working the hardest out of everything. And if you can relieve some of the tension that you're feeling up there, your whole body will feel a lot better as a result too. So it's not such a silly choice.
Wasn't better.
Although the hair growth might be different. And calves, how are we going with these ones over here?
Yeah, just softening it up a little bit.
Yep, perfect. And that's great kneading as well. And you've done the right thing too by having your hands flat, because trying to knead with your knuckles in the back of your calves when you're doing your own is quite difficult. So if you want to go deeper to get in with your knuckles, you'd actually turn your foot on the side here, and then you can do it probably with this hand. Usually with the opposite hand is easier. It just depends if you're right or left-handed. Obviously, if you're right-handed, it's going to be easier that way. But it's usually easier coming from the opposite angle. You need some more moisturiser.
Okay.
And feet. Feet is a fantastic one. It always makes you feel really good.
Especially when you have terrible feet.
Yep, yep. What you find too when you finish with feet, slapping is a really good one. Feet are a really hard one to relax, because obviously as soon as you get back up, you're back on your feet again and you're working them again. So to revitalise them after your massage is usually a really good feeling as well, because they're not going to be able to relax. Unless you're massaging and then going straight to bed, really you massage and then make them work again. So to wake them up after you loosen them is usually a really good idea. You should all be feeling pretty good now.
One part of our body, yes.
Perfect. Perfect. Excellent. When you do that one too, see how you're hitting with a flat hand? If you cup it, you'll find you actually get a better result. Perfect. Perfect. Alright, so does everyone think they have a pretty good idea on how to perform self-massage? And yep. So I'm just going to let you have a play now. Just run through. Just what I've got on the board actually is a couple of examples to try at home. So what I've done is prepare a shoulders and arms one and a feet one. So basically you can just follow those steps, and it just gives you a good idea of performing an actual routine. So what you're all doing there, perfect. You're actually following all the different methods of massage. But if you create a routine about it and do things in order, you'll actually find you get a nice, thorough self-massage. So I've just created shoulders one, a feet one. You can create your own. They don't have to be the same as this. They can be in different order. It's whatever suits you. But if you find something that works and you need to write it down, it's probably a good idea, so you can always refer back to it if you need to. So I've just got those two up there so that you can see them. Yeah, you can do that at home whenever you like. So what we're going to do now is move on to foam rollers. So if you just want to take a seat again for me. So foam rollers, if you remember going back a few slides, there are a couple of different ways to perform self-massage. The myofascial technique, I should say. Self-massage was the number one, and foam rollers is two. So has anyone ever seen or heard of one of these before? So a couple have, couple haven't. Foam roller. It's very simple concept. It's basically just dense foam. They've been around for a while, but you can see them different lengths. You can get them with bumps, you can get them flat, more dense, less dense. It's basically just a pool noodle that's more dense and a bit wider in diameter. Really handy because they're a fantastic way of releasing muscles, and they're very small, light and portable. So whenever you're going away for a training event or a racing event, it goes in your bag easily. I've had people take them overseas before in suitcases because they're so light, they basically take up nothing. And it's like taking your personal massager with you. So really, really good way. Applications of foam roller. So it's based on an acupressure concept. It's very simple, really. And the idea is that when there's pressure on a specific surface of the body, it will release. Athletes have been instructed to use foam rollers in sensitive areas of the muscles, like trigger points and knots, areas of high muscle density, and you can roll it to decrease the density and overactivity of the muscle. So it's just a good technique that way. So the benefits, as I sort of touched on before, you can apply everything yourself. So you don't have to wait to get into an appointment. You don't have to get somewhere to do it. It's always available and you can do it wherever you like. You can control your own intensity with your body weight, which is very handy when you've got a very particularly sore area. You can reduce the incidence of injury by using them regularly, reduce tightness of the muscles. As I said, portable and unlimited availability, and it's low cost. So usually one of these set you back about $40 to $50. The longer ones can be up to $90. I personally feel the smaller ones are really good for travelling athletes. The big ones don't fit in suitcases, so they're really good if you're going to keep it at home and not take it anywhere with you. But I personally find these 45 centimetre ones are the best for portability. So, and they still cover, unless you're a very wide type of person or need a lot more area, they will cover most areas that you need to cover anyway. So question for you, would you use a foam roller prior to exercise or after exercise?
Both.
After.
So we've got a both, we've got an after.
Before and after.
After? What do you think?
After.
After, so 3 afters and a both. Well done. Answer is both. So very similar to the massage technique before, you can use it to release, to relax muscles, but you can also use it to invigorate muscles. There's no universal agreement on when to roll, how hard to roll, any of that. Generally just techniques are used before and after a workout. So foam rolling prior to a workout can help decrease muscle density and promote a better warm-up because it's already ready. Rolling after a workout can help muscles recover from the strenuous exercise. So really no hard and fast rule. Whenever you feel like you want to roll, it's a great time to do it. So we're going to have a bit of a discussion. I want you to have a think about what you think would be better. Is physio and physio massages as one group or a foam roller? Just have a think about why you would pick one over the other, or whether you would keep them equally, and why you would consider that. And I'll just give you a few seconds to have a think, and then we'll go through and discuss. And I'm happy for everyone to discuss amongst themselves too, if you'd like to.
Because you've got that with the done time.
In the physio, you're getting the whole package.
Yeah,
You're getting, and it's an experience.
but you can't always get to the physio.
True. Yeah. There's pros and cons for both, isn't it?
There are pros and cons for both, definitely. I guess the simple answer is physio is better. I say that being a physio, I try not to be biased, but it simply comes down to hands-on work is better than foam. So if you've got the chance to do, or the option I should say, to do one or the other, physio or seeing a professional is always going to be a better option. Foam has the huge bonuses of being portable, being available, but foam can't feel injury, it can't feel tissue, it can't give you feedback. So hands are directly connected to the brain and they can feel. So if you require something more in depth, or if you do actually have an injury, you will always be better to seek physio. So it's good to have a good idea of when you would pick one or the other. And as athletes, I think we're a bit more in tune to the feel of our body as opposed to the general person that comes into a physio room for either release or injury. You generally have higher pain thresholds and limits, and so I tend to find many more athletes will wait to see a physio because of their limit. But then if they've got a actual race or big event coming up, they're the first ones into the physio because they want it fixed before that time. So probably the best option is more to always see the physio if you have an injury or if you're unsure. And if you're quite comfortable with releasing it yourself, foam roller. So, and in the meantime, in all the other gaps, when there's no injuries or concerns, foam roller as a just general routine everyday thing will usually keep you out of trouble as well. So does everyone understand that or appreciate why you would do that? So using a foam roller, you can have effective techniques and you can have ineffective techniques. It should be a moderate level of discomfort only. So as I was saying with athletes, you usually push it to its absolute limit. It shouldn't be painful, it shouldn't be bringing tears to your eyes. You should feel pain, but it should be more like a deeper massage as opposed to bringing tears. It should feel better on completion, not worse. So if you're feeling worse at the end, you've probably gone too hard. Rollers should never cause bruising. Definitely going too hard if you're getting bruising. And they're most effective on lower extremities. And the reason for that is there's general more muscle bulk and a bit more fatty tissue and muscle tissue in the lower extremities as opposed to up in the upper body where it's quite bony. So generally you'll always find better result from waist down, but it's not to say why you can't use it for anything else anyway. So tips for use with the foam roller. What I'm going to do is I'm going to go through a bit of a demonstration with the foam roller. I want you to just have a look at what I'm doing first, because then it's going to be your turn too. Now I did have 2 foam rollers. I've forgotten to bring the second one. I've just got the one. So we were going to pair up, but we'll just take it one at a time to use them. But what I'll do is I'll run through one first on the calf. I'll just get this one ready. I'll run through it first on the calf and just give you a good idea on what we should be looking at. So to put your body weight through, you first put your calf on. Now if you're tight but extremely tight and you're having a bit of difficulty or pain, just 2 legs like this would be fine. And when you lift up with your body and rolling, you're going to get some pressure through. To increase pressure, we put one foot on top of the other. It just increases the weight through the calf, and you can roll. You can roll that way. Now rolling through. So as I've got there, you spend about 1 to 2 minutes per muscle group that you look at. If you find a trigger point, so I found one right there on my calf, you hold that for about 30 to 45 seconds. And just make sure you're doing that. You keep your abdominal muscles tight. Obviously you're up off the body, off the ground I should say. Breathing slowly as well. So if you're really puffing and struggling to do it, you'll find that the oxygen to the muscles isn't as strong and you're not getting the release that you should. And you can do this 1 to 2 times a day. So it is one technique that you don't want to overdo. So stretches are the type of thing you can do a lot more. Self-massage techniques you can do more. Trigger point with a foam roller, you'd find more than 1 or 2 times a day would be quite painful. So usually only stick to a maximum of 2 per day per area. So that's basically as easy as it is. Just rolling up and down on an area. And then if you'd like to swap to the other leg, obviously just swapping over. Okay, quite easy. Alrighty, so what we're going to do, we're going to run through some. So these are some techniques I've got on the screen. got little men rolling for you, because see you've got a good idea. The hamstring one at the top here, so the back of the leg, exactly the same as the calf, but obviously the roller further up. The one on the top right there is your hips, your hip flexors, same position. The ITB down here is the fun one that I said is going to be quite painful for most people. You'll learn the hard way, but it is a great one. And then the final one is the thoracic spine. So thoracic spine is a really good one to roll out. The benefit of doing thoracic spine is not that just you're getting muscle release, but you're also getting extension into the spine and putting yourself in a better posture position. So many sports these days involve a lot of arm work, a lot of chest work, and we can become quite hunched. So it's a really good one to do just to open up your posture as well as gain some muscle release. So if someone wants to jump down on the floor and have a go, anyone that wants to start. As I said, I apologise I didn't bring the 2 rollers, I forgot the other one.
I want to try that one.
Yeah, absolutely. Absolutely, so we'll have a try. We're all going to have a bit of a turn anyway. So that's it, so perfect, so straight onto your side. So if it's very painful, that's exactly right. If it's very painful, you keep your foot exactly where you are and you just roll up and down from there. And then if you don't find a good spot, you can roll further up and then do a little section. Found a spot. So hold that for about 30 to 45 seconds and then just move on to a different spot. If you'd like to increase the pressure, this foot goes on top of this foot.
Okay. Yeah.
Can you feel the difference as soon as you do that?
Yeah.
Don't roll off the back.
Yeah. Still got the same spot.
Still got the same spot. It's a good one, that
A
one.
bit higher.
And this is what I love about a foam roller. You can feel exactly where your pain is, and you can work on it yourself rather than having to wait for a massage therapist or someone to get to the spot that you're hoping for.
Good.
I love these. They're fantastic. So while Senya's rolling on that one, does anyone have any questions about self-massage, about foam rollers?
Would the golf ball be too hard for those?
Golf ball's not too hard. It depends on the area. So what you consider, if you look at the size of a foam roller compared to a thigh or a leg, it's a great equal type size. A golf ball on a leg would be pointless. The leg and the tissue would just engulf that golf ball and it wouldn't do a lot. But golf balls are fantastic for the base of your feet. They're great for forearms.
You're not on it properly.
So areas where, yep, you're right. Perfect.
Yes.
Perfect. Sorry. Areas where you've got less muscle bulk, but you can still have tight areas and little trigger points. Fantastic.
So you'd use it roll like
Yeah,
that?
you would use it really
Or your
well
leg, whatever.
across here. Golf balls are fantastic too because the dimples they've got in them, they can actually create a bit more of a release technique. Golf balls, tennis balls, or your little massage spiky balls, they're fantastic. But golf I would generally recommend only for forearm
or leg.
and for base of foot. If you're going up here, I would suggest foam roller or the bigger spiky massage balls. I find they're a much better option. When you just be careful when you're sitting that you don't roll. Alright. That's it. So you're doing hamstrings. Perfect. So start off exactly how you are, just with both feet, putting your weight through your arms and just rolling up and down on it. That's it. So you will get...
Am I supposed to keep my feet in the same place?
That's what I was just going to comment on. You will get much more pressure through your hamstrings if you lift your feet up off the ground.
Oh.
Yep. So in the ITB, it's the exact same thing. If you lift your feet up off the ground, you'll get more pressure. ITB, you find a lot of people can't because it's so tight. But hamstrings, calves, you can usually get your feet up off the ground. But if it's really, really tight, you don't need to lift them. You can keep your feet down. I just find you get a much better roll if you do lift your feet up and if you cross your feet over the top and increase the weight bearing that way. So did you notice that straight away? Yeah. So any other questions? Did I answer that fine for you?
Yeah, that's fine. Yeah.
Any other questions or anything? or fine or easy.
Hmm.
Does anyone, the people that have seen foam rollers before, do you actually own any, or anyone got one?
I have one.
You've got one. Do you use it regularly?
Not as regularly as I should.
Okay. Now you will. Now you know how to do it properly. It's certainly great. It will be worth it.
Something else like to have a
I'm
go.
now in the blue one.
Go on, like have a turn. You don't necessarily have to do just the ones on the screen either.
Yeah, that's
Perfect. So with this one for you, at the moment you're getting a really good roll. Try and slow it down just a little bit for me. If you roll too quick, you miss the trigger points. So if you roll slower, you can actually feel the trigger points a lot better.
Put your hands behind your head out.
And the way you're doing it now is perfect, but if you lift your hands either up towards the roof or up over your head, you'll actually get even more of a stretch. That's it, and I wouldn't go any further down than that, because if you start to hit your lumbar spine, then you start to just collapse and lay on the ground anyway. So you want to keep the roller sort of just above where your arch in your spine begins, and up from there. Perfect. Have you found a specific spot at the moment?
Now I can feel bones cracking.
which is the benefit of getting the extension of the thoracic spine.
put your arms up and stretch it then.
Have a try just with your arms up, just pointing towards the roof, and see how you feel. The other thing with thoracic, just stop there 1 second. I'm just going to move it up a little bit higher for you. There you go. Try now for me. Does that make a difference?
Yeah.
Yeah.
You can't slow down.
The benefit of rolling on a thoracic one too is you can actually get a great result from not rolling, just from laying on it and arching over, bringing your arms back and just moving your arms instead. So have a try of that and just show everyone. So just feet and bottom on the ground as you are, arms straight up over your head for me, and then just reaching backwards. And you can either leave your bottom on the ground or lift up, it's whatever is comfortable. And
It's
then
as far as you can go, seriously.
and then coming back up, that's it, perfect. I think you're getting a good release from that. So that's another bonus of the foam roller. It's obviously not specifically myofascial release technique, but it's an extension technique, and if you've got a foam roller, it's handy to know that you can use it for that purpose as well. So, would you like to turn it off?
No.
Have a turn. Have a turn. We'll see. Is there a specific thing that you do at home when you use it?
ITB.
I just
ITB?
I just soften it up for you.
They do soften over time, and it obviously depends on body weight. Someone who is heavier or a bit more dense is going to soften it quicker. But I've had this one now for a few years, and it certainly hasn't softened enough for me to warrant buying another one yet. So over time, you do need to replace them, but
You need to use it a bit more then.
well, that's true. That is true. I probably should.
It's like uncomfortable now. The silence.
Yeah, that's
We're all
perfect. Did anyone want another go at it?
I'm fine.
Everyone happy with it? I'll leave it here after the session anyway, so everyone can have a bit of a play with it and see how they go. But basically, that's pretty much how we foam roll and how we self massage. Just as a conclusion, just to sum up what we've done, we've talked about how we can use self massage or myofascial release techniques, I should say, to reduce the tension, the stress, fatigue, and possible injury caused by trigger points. We went through what a trigger point is and how it can affect performance in any sport really, and everyday life. And we've applied some of those techniques to ensure optimal body conditions. And we use that via self-massage and through foam roller. So everyone fine? Any questions? Anything they've thought of that they'd like answered?
No.
That's
You've
good.
all done great today. You've all had great answers in all the discussions. You've all had some great answers and some thought, and you've all done a great job here with the massage and the roller. So I'm sure you'll all do really well back at home, self-massaging, foam rollering. Yeah, I'm really happy with how you go. If there's any feedback, I've got some feedback forms if you wouldn't mind filling out for me. That would be really good. That way I can just develop, I guess, develop the program. Make sure it's working. It's really important that not only do we learn here, but we can actually take those techniques home. So it's really good if I can get some feedback on how you thought the session was. And in future too, if you think of any feedback, feel free to email and let me know. Let me know what you're doing and how you're rolling and your massage is going. So the next step beyond this, if you went further, would be to look at stretch bands. So stretch bands is the other tool that you use more for flexibility. There's another course in that as well that you can always look at down the track. Very handy to have. Just as a reminder too, I will send out those assessments in the next week, and if I can just get you to go through them and answer them just as you're able to, that would be fantastic. We'll send them through. And then I'll send through your certificate of attendance too. I'll get it out to you. So thank you. Really appreciate you coming along and learning about your self-myofascial techniques. Appreciate it.
Thank
Thank
you.
you.
Thank you.
Thank you. I'm done.